First off, I want to start with one thing on food insecurity. We've been offered lots of food from folks. I would just like people to make sure that they call our volunteers and customer care office to find out what we might need and what we don't need. Unfortunately, there's been a lot of food dropped off unattended that creates some security issues and so forth as people just run into a hospital and drop it. And then our infection control folks are worried about different, we put in the restrictions in our own cafeteria about serving spoons and stuff. So sometimes the best intentions by folks aren't something that we can totally control here. And on top of that, there was a lot of media coverage yesterday and in the past about food insecurity issues in our community. So if you're thinking of donating food to our staff, there are other people that need it more than what we do. We have food here at Bryan to take care of our staff and then some of those other issues. So please look for resources in the community that really are dealing with the hunger crisis in our community and not us for that perspective. Severe weather season 2, it's just heartbreaking to see what happened across the South as they're dealing with that, and it's just a reminder for everyone to be attentive to the season we're going into as we're going with that and be prepared for that as well. Quickly with some numbers, our midnight census was 366. Our Bryan Easy Visit screening questionnaires, now 8,989 people have completed it, resulting in 2,573 easy visits, and 1,187 have used the COVID promo code. Overall, we have tested 1,453 at Bryan. We now have 64 positives, 1,295 negatives, and there are 94 pending. Putting that into context, this morning on the DHS website, there were 1,580 tests conducted in Lancaster County. Bryan's accounting for 92% of those. So we're very proud of what we've been able to bring to the community. I would just also add that testing remains an issue, and we wish there was more availability. Right now, North Dakota, Vermont, Montana, South Dakota, and Alaska are the only states that have tested fewer than Nebraska. So that'll get into a few of our questions that were sent in advance a little bit later. With that, I'm going to ask Dr. Matt Johnson to come up and offer some remarks.
Thanks, Bob. Just wanted to take this opportunity to address any cardiac concerns that are going along with COVID. First of all, regarding the clinics that we have established, Bryan Heart has a lot of clinics here in Lincoln, as well as many other communities in Nebraska, as well as Kansas, Northwest Missouri, and even parts of Iowa. So we took an early initiative based on some national direction to really go to a telemedicine or a virtual type clinic. You'll see these as our schedulers do call previous patients that we have established and new patients to initiate these televisits or virtual type visits. And we've been very successful doing that with Bryan Telemedicine as well as some other electronic avenues. In regards to Lincoln office, we are still doing a virtual clinic here in Lincoln, but if we do feel that patients need to be seen due to symptomatology, that might be something that we can't deal with over the phone, we are scheduling face-to-face clinics, including the patients in outstate communities to come to Lincoln if they need to. Now that's only in emergent type situations in those patients. For the most part, we're trying to adhere to the social isolation as well as a distancing that were recommended by state and local governments. In regards to procedures, we still are performing procedures here at Bryan, including stents and not elective surgeries, but emergent or semi-emergent surgeries. All procedures that we feel are more elective, we are putting on a later date. In regards to some of the cardiology concerns related to COVID, we are seeing some increased cardiac issues both with patients that test positive as well as some of the symptomatology that one might develop when they initiate the virus as far as infection. Some of this is related to the increased inflammation seen from the virus, we think. We're still working on the exact mechanism of why we're seeing some of this increased cardiovascular issues, but it is interesting that almost half the patients in some places that are hospitalized do have prior history of cardiac disease. For that reason, we are urging our cardiac patients to please adhere to the distancing and the isolation type approach that we have taken. There are some treatments that have been discussed regarding hydroxychloroquine. This treatment in particular can cause some arrhythmia issues in patients, and so we are establishing protocols to monitor patients that might be initiated on hydroxychloroquine, and that's something that we've established here at Bryan as well. But we'll kind of open up for any questions later.
I'm John Woodrich, CEO of Bryan Medical Center. I wanted to break down some of the numbers for today. So currently we have 22 in-house pending patients, 4 patients that are positive for COVID. Of that 22, 15 are from Lancaster County and 7 are from outside of Lancaster County. We have 2 patients that are on ventilators. We have that are COVID positive. We have ICU with 5 of our patients, PCU or progressive care unit with 5 patients, and then our general care unit with 16 patients there. And as I mentioned yesterday, critical protective equipment items that we need are gowns and disinfectant wipes. So if anyone has access to those, we would appreciate it. And with that, we will take any questions. Relationship to the surge or the volumes, I'm not surprised at this point in time. I do believe that the people of this community have taken this pretty serious. They are social distancing, they're trying to isolate themselves at home, and they're listening to our health department and our government officials. That's the best thing we could ask for. But I do want to put out a warning to folks that in regards to our predictive model, we believe that we're going to hit our peak in a couple more weeks, so we haven't hit that level at this point in time. You know, I think if any of you have been watching what's happening in Grand Island right now, we have seen an exposure because of people getting together, and that is what we can't risk to happen here in this community. So as long as people continue to follow those guidelines, I think we're going to be successful in not having that surge be as big as we've seen in other parts of the country. As we continue to look at the flattening of the curve, we're making a big impact. I mean, if you look at yesterday to today, we've only had 1 other positive case in Lancaster County. I am still concerned of what happened over Easter time. You hope that people didn't get together, but if they did, we're going to see the effects of that probably in a week or so. But I believe a majority of our people stuck to the guidelines that we wanted to, and that's the way we're going to make an impact of not having this be that worst case scenario. We'll be looking for those signs of when we can ease up and get back to normalcy. But you know, as other parts of the country have been aware of, that you could see another surge occur, and you want to make sure that we don't go back to kind of the normalcy that we were used to. So we're going to be very cautious. So I think as things develop and we start to see the flattening of the curve, or we start to see the number of cases going down, we're going to look to our health department, we're going to look to our government officials, and they get input from us as well. This has been a collaborative effort to where we start to loosen up some of those guidelines and see if we can start to do more cases here, have people get together larger than in groups of 10 or whatever it may be. But we just have to play it day by day and watch what the trending is showing to us.
At Bryan Heart, we took a very early, aggressive approach, and we did transition all of our outside of Lincoln clinics to a virtual type clinic visit. In Lincoln, 90% of our visits are now converted to virtual clinics, and only the patients that we feel, that need to be seen face to face and have testing done are seen in Lincoln office. We are seeing association with other things besides just coronary disease in these COVID positive patients. And so high blood pressure, obesity, and other cardiovascular risk factors have also been found to be associated with a higher risk for COVID positive patients.
The new hospital in Grand Island, which Bryan is an investor within that hospital, we do have the state coming out next week for their licensure inspection. And we've been in contact with them about if that need arises that we need to open up that facility. We'll look at plans. We also have to look at staffing as well. But should that surge not be handled by the current hospital in Grand Island, they have the capability of sending patients to Lincoln. That's part of what Bryan Health has done throughout its time is we service all of greater Nebraska, and that would be an alternative until that facility is able to be opened. In the past, we've talked about our relationship through the Heartland Health Alliance with all of the critical access hospitals and other hospitals across Nebraska. So we have an agreement with them that they can send patients to us, potential COVID patients, but we are looking at it over time, and that's part of our surge plan, that we want to find out, is there a way of managing those people within those communities as well? We can do it through telemedicine. But it's also the protective equipment. Will they have that out in those rural areas? So for now, we're able to take more of those patients within Lincoln just due to our volume or our census due to not doing elective surgeries. But should the surge rise to a level, we will look at a different way of trying to manage those individuals locally. A lot of these other specialties have been working with our telemedicine network so we can offer services to folks in a different fashion. Part of this has just been our plan as we've grown our telemedicine. It's a shame that something like this has to happen within a community or within a country for people to see the value of telehealth. But this is really a great way that people can have access to different specialists and different specialties. So yes, they are taking advantage of that at this time.
There is heightened awareness on that. In fact, when we were starting this all up, in February, after one of the first meetings that some of us sat on, our message was we have to try to keep this out of the nursing homes and assisted living centers at all costs. So we're all doing all we can to do that. But thankfully not anything like we've seen in other parts of the state yet here in Lincoln and Lancaster County.